Well, good afternoon, everybody, and I'm delighted to be here speaking to you, and thank you for the invitation. I'm particularly pleased to be in Leeds and to be speaking to you in a building called Aspire. What better venue could we have? The old Yorkshire Bank in Leeds. And my journey actually is not very exciting in terms of the distances that I have travelled. But Leeds has been absolutely a linchpin in that journey. So I've been around Yorkshire. I've been around Yorkshire for a long time. I had a brief sojourn over the other side of the Pennines when I was training to be a paediatrician. But I started this part of my journey in the University of Leeds. I had 5 rejections from UCAS, as it's now known. So I went into my A-levels not knowing what was going to happen. And clearly I don't think the school believed that I was going to be able to make it to be a doctor. And when I did get to the university, I just couldn't believe that I was there. And the first year in particular, I remember thinking, I still can't believe that I'm here and that potentially I'm going to be a doctor. So it's really great to be back in Leeds now as a senior leader within the trust. When it came to choosing a career, I was very ambitious, really. I knew I wanted to be a consultant. I knew I wanted to be a hospital doctor. And I'm not quite sure why that was, because Holby City and casualty didn't exist in those days, and I'm not telling you what did, or it will really age me. But in my training as a medical student, there was quite a paucity of women in senior roles, particularly in consultant posts. So there was word of a female consultant in Pontefract, but she was single and didn't have a family. But when I looked around in paediatrics, there were some female leaders. There were women who were SHOs, there were women who were registrars. And there was this lady here, Jane Wynne, who was a consultant paediatrician in Leeds for many years and sadly passed away from Parkinson's disease. But she and some of her colleagues were certainly an inspiration for me in terms of choosing to be a paediatrician. I did like paediatrics. I still love paediatrics, but I also loved adult medicine. But at the time, I thought I would probably not be successful. So throughout your career as a doctor and as a woman, you have quite a number of hurdles to climb. And I suppose I wanted it all. I was married when I was an SHO, and I also wanted a family. But I knew I had to pass the exams. I won't tell you what we called the exams, but we had to pass the exams before thinking about having a family. And the little girl in the middle is my daughter, and this was taken at nursery. I honestly had no influence over this photograph. She's now an F1 doctor in Bradford, and I'm really proud of the fact that she's a doctor. But I didn't put any pressure on her, well, not knowingly anyway, to become a doctor. But I suppose I chose, and I was lucky that it happened this way, to start my family when I was in a 2-year rotation. And I sort of planned it so that I would have done a significant part of the rotation, hopefully be pregnant, have maternity leave, and still have a bit of the rotation to come back to, because I was quite anxious about whether or not I would be able to get a job with a young child. Anyway, I was very lucky. It did all work out for me. But when it comes to what would I do differently, well, I actually went back to work when Steph was 3 months old. And I wouldn't advise any of my female colleagues to go back to work that early.
again. I think it has to be about your choice, clearly, but it would have been nice to have had a little bit longer off. Fortunately, there was a part-time training scheme for senior registrars, but you had to apply for those. It was a national scheme. The good bit was, if you got on the scheme, the funding went with you. So your funding would go where you wanted it to go. And actually, having applied for a full-time senior registrar post in Leeds and not having been successful, I was a bit bitter about that. So I cut my nose off to spite my face, increased my travel time, and did it in Manchester. But that was a good scheme for a small number of women, but it was highly competitive. And if you didn't get into that scheme, then really you had to continue to work full time. So it's important to keep it personal, and you have to make those choices, but you shouldn't be afraid to make those choices. And perhaps one of my, I've got a couple of really emotional moments really as a senior medical manager, and one of them was when we appointed 2 female consultants who were job sharing as a neonatal post in Calderdale and Huddersfield, and both of them were pregnant when they came for the interview. We appointed them, and they came back to work after they'd had their babies, and they made a great job. So what are the features of successful clinical leaders? And I have listed some of them here, or demonstrated them here, and perhaps I'll talk about a few of them as I go. But Alison has already mentioned some of these that are really important. And these are features of successful leaders anywhere, really. And they're not just about female leaders, but perhaps we sometimes have had to demonstrate them a little bit more than male colleagues in the past. So sometimes you've got to be tactical. And these are photographs of Calderdale Royal Hospital. The top photograph is of the old Halifax General Hospital, and the bottom photograph is of the new Calderdale Royal Hospital. And when I was looking for a consultant post in 1993, I needed a job in West Yorkshire because have Steph by then. She was 2 years old, and I didn't want to be living away from home when I was on call. And at the time, the paediatric service in Halifax was, well, poor would be being kind, really. And I can remember going and having a look round and coming back and saying to my husband, it's like something out of Romania. And at the time, the Ceausescu regime had just broken down in Romania, and all the film about orphanages and dreadful facilities were there. Well, the children's ward at Halifax General wasn't much better. But actually, it was close to my home. They needed somebody with some vision and enthusiasm. I don't think I knew I had vision at that stage in my career, but I certainly spoke to them before I applied for the job to say, if I come to work here, things have to change, and these facilities are not good enough for children, and we have to change them. What I wish I knew then was they must have been desperate to find somebody like me. But I still felt incredibly nervous when I went for the interview, and how things would turn out. But however, I luckily got the post, and we managed to revolutionise paediatrics in Calderdale. And it was clear that being 5 miles away from Huddersfield Royal, we didn't need 2 neonatal units, 2 paediatric departments, and actually 2 obstetric departments, because in those days births were going down, and actually public health were predicting that that was going to be sustained. That didn't actually turn out to be the case, but we started talking about how the services needed to merge. What came out of that was a very difficult public campaign. There was a Born in Halifax campaign, a Born in Huddersfield campaign, and but eventually the health authority made a decision that services needed to merge. What came out of that was that services, well, actually the trusts needed to merge. And I can remember feeling a bit like that pussycat, because I was sat round the operational management board table as the only female clinical director, and all the male clinical directors looking at me and pointing and saying, well, it's all because of women and children's that this merger has been proposed. It was one of those occasions where being a woman was a real, because we cry, not very often, and I could probably tell you the number of occasions on less than 5 fingers, how many times I have felt like that. But that was one of those moments. So I couldn't speak very much because I wasn't going to cry in front of them. But the irony of it was that actually over the next couple of years it became very obvious that having one gastroenterologist in one hospital and one in another wouldn't work either. And the last service to actually reconfigure was women and children's. So surgery reconfigured, head and neck reconfigured, way before the women and children's did. But sometimes you have to be brave, and resilience is really important. And finding, where do you get your resilience from? It is from your mentors, your coaches, your family as well. So I worked my way through the medical management structure in Calderdale and Huddersfield, and I became the medical director there in 2007. And I thought if you cut me through the middle, I would have Calderdale and Huddersfield stamped all the way round, just like a stick of Blackpool rock. But after 3 or 4 years, I thought, well, am I going to stay in this role for the rest of my career? I don't think that would be great for the trust, and actually, I don't really think it would be good for me. And I had an email saying, would I be interested in a job in Hull? And I do remember thinking, who the heck would want to go to Hull? I should have held that thought. But I went to have a look. And you know what? I absolutely loved the Humber Bridge. And it wasn't just because of the bridge that I went to Hull. It was a trust in difficulties, but I believed that there would be great doctors and nurses and other health professionals there. And you know what? I was absolutely right. There are. But I had to take the risk of applying for the job, maybe not getting it, but if I did get it, living away from home, and also leaving my comfort zone in Calderdale and Huddersfield. So I did get the job in Hull, and I did go there, and I learned absolutely loads. I learned lots about how to be a medical manager, in addition to those things I already knew, and I learned a lot about myself. And there were fabulous doctors, nurses, and others in Hull. But equally, the job in Leeds came up, and I thought, well, if you're a career medical director, this really is the big job. And also, I discovered that I didn't really like living away from home Monday to Friday. So the job became available, and I just wondered if I had the confidence to apply for it. Just as Alison said, you actually start to think, well, I'm not sure I'm the right person for a job like that. But I did all my homework, and I talked to lots of people, and I thought, well, actually, what's the worst that can happen? Well, I might not get the job. But I'm delighted to say that I did, and I love working in Leeds. And it has been a big step, but it has the ability to influence, the ability to work in the city at a time when we've got a lot of change, positive change in the senior leadership, and the relationship with the university was an opportunity I wouldn't have wanted to miss. Part of my role as a leader, I think, is explaining to other doctors in senior positions that we are all leaders. And it's really important that we take care of one another. And I think as women, it's important that we take care of one another as well. And so having respect for one another, whatever levels we are at in the organisation, trying to flatten hierarchies, ensuring that our trainees feel part of the team, whether they are nursing, medical, or management trainees. Really helping each other to enjoy our job. We have to have a laugh. It is hard work, and we face difficult decisions, and we have difficult scenarios, but we have to be able to have a laugh together as well. And we also have to help each other understand the rules we play by and how we'll be judged. And I think that really applies to us as women as well. And so, as Alison has said, working hard and showing that you can do the job as well as any of your colleagues is important. So we have a great opportunity here in Leeds to make a massive contribution to the economy of the city, to the development of one another within our organisations, and particularly to help to support the female leaders. And I've said all of this before, but what I would say is optimism has perhaps been one of my strongest characteristics and has helped me through some very difficult times in work. So remember that all of us are leaders. It's not structures that make organisations work, it's people. And we need innovative, passionate staff. We have women now in surgical specialties. It's fabulous to see the number of female trainees we have in a wide range of specialties. So you all need to know, and I'm sure you do, that women can be great leaders, and we can have it all, the family, the career, and everything else. So thank you very much.